Assalamu alaikum everyone and welcome back to my YouTube channel. Today we will learn about obsessive compulsive disorder. Obsessions are basically thoughts, urges or images that cause mark anxiety in an individual, and the individual attempts to suppress such thoughts to neutralize them with other action or thought, that is performing a compulsion. Now what is compulsion? They are repetitive behaviors or mental acts that is performed in response to obsession. These behaviors or mental acts are aimed at preventing or reducing anxiety, and they are time consuming and cause clinically significant distress. Now, here's a story of a girl who is having a obsessive and compulsive disorder. When she wakes up in the morning, after performing her routine activities like brushing her teeth, she starts to organize the things in an organized way or in an ordered way, and if she does not do that, she feels anxiety and severe distress. So she spends almost all the day in organizing her things in an ordered way. Often when she is sitting and doing her work, she is faced by obsessions. She is disturbed by thinkings like, did she lock the door, or is her grandma okay? And she thinks that there's someone who is murdering her grandma. So she is facing distress and anxiety all of the time. So basically, obsessions are related with order and exactness of thing, doubting, and they can be religious, they can be related to contamination, they can be related to aggressive behaviors, they can be related to sexual and violent behavior. When she goes to the school, she is often late just because due to her obsessions, that she thinks of that either she locked the door, either she has kept the things in a proper and ordered way, and these obsessions basically cause fear and anxiety in her. The obsession causes fear, and the obsessions causes anxiety to a marked level, and when these fear and anxiety are leveled up, then the compulsions are basically performed to reduce the fear and anxiety. So basically, compulsions are the behaviors that are performed in response to the obsessions, that is the thoughts or urges, and due to performing these compulsions, that is the behavior, an individual might feel relief for some time. So basically, compulsions can be of several types, like cleaning and washing again and again, checking the things, ordering the things again and again, and hoarding. Like the girl, she often orders the bottles in her fridge, and she spends of her day in ordering the bottles in an exact manner, and after making an exact order, she feels relief for some time. But after some time, she again feel obsessions, that either she has ordered the things, she has kept the things in a arranged manner or not. This girl basically liked dance, but due to her obsessions, she is severely disturbed, and her grandma is worried about her. So her grandma basically notices her behavior, and she often help her, and she starts cleaning with her so that her obsessions can be controlled. So her grandma advises her that if she is facing a problem, she should consult a doctor or a psychologist or psychiatrist, so that her problem can be solved and she can spend a normal life. So due to advice of her grandmother, she visits the doctor, and the doctor says her that she is having obsessive and compulsive disorder, and her disorder can be managed if she can take certain drugs. So the doctor recommends her certain drugs and says her to try to manage her behavior, and and these drugs will help her to take the obsession slightly and to spend her life in a normal way. So due to such medications and due to the advice of her doctor, she basically She basically spends her life in an ordered way. Her obsessions and compulsions are controlled, and slowly she became a normal person. So, these obsessions and compulsions can be controlled by certain medications, that is, antipsychotic drugs, and these drugs are also helpful in reducing the urges that causes anxiety. And the therapy also works. Due to certain therapies, the individual might feel better. So, after using certain medications, she is quite relaxed and she is never late for school again. So, she is always on school, always on time, and the obsessions that were disturbing her before and the compulsions she was performing, that does not happen again. And she tried spending her life in a normal and good manner. So her friend also says that it's good that you are on time. Thank you.